In this segment, what we're gonna do is perform the whole routine. We're gonna incorporate and blend all these stretches into a 10 to 15 minute routine. I'm just gonna show you the basic stretches for each joint, the hip, the knee, and the ankle joint, and basically you're gonna do the same in both sides of the body. The first thing that we're gonna do is we're gonna perform circumduction at the hip joint. Again, this will help to lubricate the hip joint in order to decrease the tension of the joint. And this way, it will allow for more range of motion. After this, we're gonna move on to the glutes. And basically, when the patient is in a supine position, you will be stretching all the muscles that are posterior to the leg. Glute stretch. We're gonna go outside the knee and perform the stretch on the glutes. How's that feel? And you're gonna repeat this stretch as needed depending on the patient and the need of your client. From here, we're gonna move to the proximal fibers of the hamstrings. This is flexion of the hip, knee, and then we start extending at the knee joint. How do you feel there? From here, we're gonna go and have the knee extended and then perform the stretch. We're stretching the distal fibers of the hamstrings muscles. If I want to functionally stretch the hamstrings, I will have to release the gastrocnemius. So on this sequence, I will hold this stretch right here, and then I will stretch the gastrocnemius and the plantaris. That way, I can enhance the stretch that I'm doing to the hamstrings muscle, specifically the distal portion of them. Once I release the gastroc and the plantaris, I will go back to stretch the distal end of the hamstrings. And remember to keep the knee straight and not to put pressure on top of the knee. You don't want to be on top of the patella. You want to have your hands above your kneecap. After this stretch, we're going to move into the hip joint again to stretch the piriformis and the 6 deep lateral rotator muscle. To do that, we're going to perform external rotation, so the leg will be again in a 45-degree angle, and then move to the opposite shoulder. How's that feel? Like I mentioned before, if you want to keep the stability of the hip joint and the pelvis, you want to move the opposite leg towards the side of the leg being stretched. In that way, you will be able to isolate much better. Again, this stretch will take care of the piriformis muscle, the obturator muscles, and the external rotators of the hip joint. From this position, I'm gonna put my thigh on the table just to rest the ankle of the client. That way we can move to stretch all the adductors muscles. Again, I can keep this leg in this position slightly in adduction, and then I will stabilize on the ASIS, drop the knee, stabilize here, and stretch the adductor muscles. Like we mentioned before, we have 5 muscles performing adduction, but there's only one that crosses the knee joint, and that's the gracilis. So in this particular stretch, we emphasize in the top adductor muscles except the gracilis, the pectineus, the adductor brevis, longus, and magnus. And in order to get the gracilis, we're gonna hold the leg straight. We're gonna perform a deduction, as a matter of fact, a abduction, stabilize the leg at the thigh, rest the leg that we're stretching in my thigh, and then perform the stretch. Here, all the adductors are being stretched, but again, we are emphasizing a little bit more on the gracilis because of the fact that the knee is straight. And if we perform a slight external rotation at the end of the stretch, the patient will be able to feel the stretch more deep. How's that there? How are you feeling there? As you can tell, she's very flexible. We basically finish all these stretches that are working on the hip joint in a supine position. Having the patient in this position, we can take advantage and stretch the calf muscles there. Make sure that you always keep proper body mechanics so you can protect yourself. Now we're just stretching the soleus, the gastrocnemius, and the plantaris at the ankle joint. After we finish those stretches, what we're gonna do is we're gonna turn over, go facing down. And in this position, we're gonna go back to the hip, but this time we're gonna be stretching the muscles anterior of the hip. We're talking about the psoas major, the psoas minor, the rectus femoris, that are the ones that are mainly on the hip joint. Here we also stretching the TFL. The TFL main work or main job is to perform a abduction, but in this case, because of the location of the muscle in relation to the femur, will also assist on flexion at the hip joint. So in this position, we will be able to stretch those muscles as we perform extension at the hip. Again, we're gonna keep the stability. I don't want you to compress, I just want you to keep the hip stable and the pelvis stable so you can isolate those muscles in front of the hip. Again, we're talking about the iliacus, the psoas major, the psoas minor, the tensile fascia lata. The rectus femoris also stretch on this segment, but it can also be a limiting factor of the hip because the rectus femoris also crosses the knee joint. So if the rectus femoris is tight, you want to be able to place the hip back into their original position and stretch all the quadricep muscles at the distal end of the knee joint. Specifically, the rectus femoris, due to the fact that it is the only muscle that crosses the knee joint and the hip joint. All the other quadricep muscles, the vastus muscles, only crosses the knee joint, but they're not active on the hip joint. So I can release the quads, and then after releasing the quads, I can go back to stretch the hip. This time, the rectus femoris has been stretched, so it will not be a limiting factor for the hip joint. And that's what makes stretching more functional. It's the sequence that you have to follow based on the need of your client. Very good. After we finish here, we already stretched the quadricep muscle, so we can just move to the ankle joint. And in this case, because the knee is flexed, we're working very specifically into the soleus muscle. Okay. Okay, and that will conclude a sample routine of the lower extremities with the hip, the knee, and the ankle joint.